Hey guys, Dr. Dailey here. One of the top questions that is asked on the internet about fibromyalgia is what triggers a fibromyalgia flare-up. Fibromyalgia flare-ups can be triggered by a variety of factors, and although the exact cause of fibromyalgia is different for each individual patient, it's important to note that the triggers can also vary from person to person, and what causes a flare-up in one individual may not affect another in the same way. So here are some common triggers for fibromyalgia flare-ups. Now, you will notice that some of these triggers are in your control and others are not. My recommendation and encouragement is to control the things that you can. So stress, well, emotional or physical stress is a significant trigger for many people with fibromyalgia. High stress situations, anxiety, and other forms of emotional distress can exacerbate the symptoms. Then there's weather changes. Some individuals with fibromyalgia are sensitive to changes in weather conditions, especially cold or damp weather. And I know a lot of you are shaking your head. These changes can lead to increased pain and stiffness. Then there's physical overexertion. I have heard from patients over the last 15 years if they do too much the next day, and maybe 2 or 3 days after, they are just wasted. They're ready to lay down and just rest. Overexerting yourself through physical activities such as strenuous exercise or lifting heavy objects can lead to a flare-up. It's important to pace yourself and avoid pushing your body too hard. Then there's lack of sleep. Poor sleep quality or inadequate sleep can trigger or worsen fibromyalgia symptoms, and sleep disturbances are a common feature of the condition, and addressing sleep problems is absolutely crucial for symptom management. Then there's hormonal fluctuation. Hormonal changes, such as those related to the menstrual cycle or menopause, can sometimes trigger or worsen symptoms in women with fibromyalgia. Infection and illness, viral or bacterial infections can lead to increased pain and fatigue in individuals with fibromyalgia. Managing and treating infections promptly is very, very important. The tough thing here is that some, not all, a percentage of fibromyalgia sufferers actually have hidden viral infections that may rise to the surface periodically. Certain foods and dietary factors. Some individuals with fibromyalgia report that certain foods or dietary factors, such as caffeine, sugar, processed foods, can exacerbate their symptoms. Keeping a food diary may be helpful in identifying potential triggers. Then environmental factors, exposure to certain environmental factors like strong odors, smoke, allergens, they can aggravate symptoms for some people. And then medications and side effects. Certain medications or changes in medication regimes can affect fibromyalgia symptoms. It's essential to communicate any new medication or changes to your healthcare provider. Mental health conditions, coexisting mental health conditions like depression and anxiety can contribute to fibromyalgia symptoms and exacerbation. And many people that I have worked with, if you've had fibromyalgia for 20 years, do you think that would make you depressed? I think so. So that's a very, very tough issue. But addressing and managing these conditions is important for overall well-being. Now, it's important for individuals with fibromyalgia to be aware of their specific triggers and try to manage or avoid them whenever possible. Keeping a symptom diary or journal can help identify patterns and potential triggers. Additionally, working closely with hopefully your functional medicine practitioner to develop a comprehensive treatment plan that includes strategies for managing flare-ups is absolutely essential for effectively managing fibromyalgia symptoms. Guys, if this has been helpful for you, please like and share the video. If I could be of any help to you, I'll leave my number here. You're welcome to call the office. We often do a free telephone consultation if you'd like my help. Thanks so much, guys. God bless you and have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.